With the approval in December of two vaccines for COVID-19, the race is on to vaccinate as many critical populations as possible before the current spike in COVID cases takes more lives. But who exactly are these populations? Who gets to decide who goes first and why? And, well, when am I next? In episode 1 of this COVID vaccination series, we looked at where the leading vaccines are in the approval process, including the two approved from Pfizer and Moderna, and how long it would take to get America vaccinated, concluding that we would be COVID-free by New Year's Eve. Next New Year's Eve. So if vaccinating the country is going to take all of 2021, who goes first? Well, ask the government. They own the vaccines. As part of its pandemic response, the federal government purchased all available supply of COVID-19 vaccines and will continue to do so throughout the year. So you won't have to pay for the vaccine, but the government decides when you get it. The Center for Disease Control is in charge of setting guidance on the order that populations get vaccinated, called prioritization. This guidance is based heavily on recommendations from the CDC's Advisory Committee on Immunization Practices, or ACIP. The federal government allocates vaccines to the states, who are responsible for implementing vaccination plans within their borders based on the CDC guidance. Mostly. States oversee vaccinations performed at the local level through public health departments and at places like hospitals, and eventually more publicly accessible venues like at the workplace or at local pharmacies. Between the CDC and states, there are a couple of federal agencies with important influence in this process. First, the Food and Drug Administration is responsible for actually approving vaccines. In theory, it can condition emergency use authorizations for the vaccines on specific prioritization requirements, essentially hardwiring the CDC and ACIP's guidance at the state and local level. But this command and control approach would undermine local autonomy and at this point is unlikely. The Department of Defense is in charge of overseeing allocation and transportation of vaccines to the states. In this role, it has made decisions that effectively diminish the role of CDC and ACIP guidance. Most notably, it decided to allocate vaccines to states based on total state population, rather than on ratios of critical populations identified by the CDC and ACIP in each state. However, this has had a minor impact on the implementation of the CDC and ACIP guidance. If it feels like there are multiple different lists of who gets vaccinated next, that's because this process can be tweaked throughout. The ACIP can make recommendations that the CDC will probably but might not confirm in the guidance. The Department of Defense could alter that guidance based on how vaccines are allocated. States can diverge from the federal guidance in establishing their own vaccination plans, and as we will see, that is exactly what states are doing. Finally, myriad choices at the places where needles are actually stuck in the arms can ultimately decide who actually gets vaccinated next. Prioritization is this complex because it entails many difficult policy choices. There are basically three elements to determining prioritization. One's personal health risk, for example being older or having a pre-existing condition. Possibility of exposure, such as with healthcare workers. And finally, the importance of individuals' jobs to society. In theory, just add these variables up and we get priority. But in practice, it is far from simple. How are these factors weighted? Which is more important? This is where things get more complicated. Should workers running our critical infrastructure be prioritized? How about those over 65? Or should those groups be switched in line? What about people with pre-existing risk due to lifestyle choices like smokers? Should they be moved up in line? If you think I'm just trying to be provocative, it's already happening in New Jersey. Because New Jersey, there's a magazine dedicated to the state being weird. And even more controversial, should we prioritize prisoners who are, after all, at higher risk of transmission? That's what my home state of Illinois plans to do. But to be fair, we also need to make sure that our governors are taken care of after they leave office. The federal government has been planning vaccine distribution since at least the 2009 H1N1 flu pandemic. Based on that experience, the CDC came up with a vaccine prioritization plan for COVID-19 that broke vaccination up into 3 phases, corresponding to the availability chart we discussed in the last episode. Phase 1A would be focused on healthcare workers. Phase 1B would include essential workers who could not socially distance, those over 65, and those 16 to 64 at highest risk. Phase 2 would include essential workers and those from 16 to 64 at higher risk. And finally, Phase 3 would basically be everyone else. The ACIP modified this approach, adding a new Phase 1C. In early December, it recommended that Phase 1A include healthcare personnel and those living and working at long-term care facilities. At that time, it indicated that Phase 1B would include essential workers and Phase 1C would comprise adults over 65 as well as those from 16 to 64 at high risk. However, weeks later, when issuing recommendations for Phase 1B, the ACIP further modified its prioritization recommendations. It created a new frontline essential workers classification and subdivided out those over 75 from adults 65 and older. Notably, it switched those two new categories, essentially prioritizing adults 75 and older over those essential workers deemed to be not on the front lines. The ACIP defined frontline essential workers as workers who are in sectors essential to the functioning of society and who are at substantially higher risk of exposure to SARS-CoV-2. The category was determined to include jobs like first responders, teachers, and grocery store workers, while essential workers included critical infrastructure workers, food service workers, and attorneys. Personally, I think excluding certain workers from the critical infrastructure sector may have been an oversight. Full disclosure, I represent clients in this area, so I'm biased. But I still think a strong argument can be made that at least a subset of employees in such companies, like operations room workers or linemen, who are critical to reliable operation but cannot work from home, should be prioritized. Ultimately, it falls on these companies to advocate for their local leaders to use authority over state implementation plans to address this issue. Finally, otherwise healthy individuals 16 to 64 would comprise Phase 2, while Phase 3 would administer vaccines freely to anyone who hadn't received one yet. One may look at this chart and ask, what about children under 16? The problem is we don't have data on the vaccine's effect on children. In fact, Moderna just announced that we may not get that data until 2022. So at this time, it is unclear where children would be prioritized. Hopefully we'll get more answers soon. So what are the states doing with this federal guidance? Well, generally, they are following it. Those states are making modifications based on their view of policy issues as well as the composition of their citizenship. Two jurisdictions, Washington, D.C. and Utah, moved long-term care facility residents to Phase 1B. Nevada, New Hampshire, and Wyoming added law enforcement to Phase 1A. Massachusetts included prisons and homeless shelters in Phase 1A. It is in Phase 1B where states are taking the most action. 8 states, Florida, Delaware, North Carolina, Alabama, Maryland, Tennessee, Texas, and Illinois, have prioritized all adults over 65 and those 16 to 64 at high risk above essential workers. 5 states, Nevada, Nebraska, North Carolina, Alabama, and Oklahoma, have included prisons and homeless shelters into Phases 1B or 1C, with Delaware and Tennessee prioritizing prisons in Phase 1C. This is in addition to Illinois, which we discussed earlier. States are still releasing specifics about their plans, so fast that this list is already outdated. Suffice to say, though, states are using their authority to specifically tailor immunization plans to their jurisdictions. So we now have a plan to figure out who gets vaccinated next. In fact, we may have 50 different plans, but anyone following the news knows that vaccinations are not going according to plan, however many there may be. Administered vaccinations are falling well behind what was expected at this point. So what is taking so long? Well, that's a topic for our next episode. Hey guys, thanks for watching. If you found this useful, please click the like button and subscribe to the channel to get notified of future episodes. Also, I've left a link to the first episode, so take a look. As always, if you have any thoughts or questions, please leave them in the comments below. Until next time, stay safe.